There's no easy way to lose a child. It's no word for it. That kind of pain, but to lose a child to suicide it's a different kind of hurt.
7 months ago, Jessica Prendergast's 13-year-old son, Austin, took his life at Wendell Middle School.
He was sweet and he was loving. We have a big hole without him.
For years, she says, Austin struggled with bullying and other mental health challenges. He received therapy, went to a treatment program, even was hospitalized. The family experienced firsthand the limitations of mental health resources for youth in North Carolina.
You wait in the emergency room for a bed to open up because facilities are just full. I mean, he was even hospitalized all the way in Winston-Salem because there were no beds here.
The state says each day more than 50 kids wait for behavioral health services in emergency rooms. Duke Health has seen a 44% increase over the last 2 years in the number of kids seeking psychiatric services at its 3 emergency rooms.
If we don't act now, I don't know that we're going to be able to cope with what is going to happen in terms of loss, the youth who die by suicide, the providers who leave the workforce.
In an attempt to control the crisis, school systems across the state are stepping up. State data shows $5.4 million of pandemic relief money has gone to school health support, with 15% being directly related to psychological contracted services. The North Carolina Department of Public Instruction also announced $17 million of grants to boost mental health providers in 15 school districts. Both Wake and Durham County Public Schools are currently seeking to expand in-school mental health providers.
I think a pretty bad situation for all school systems if they didn't have any sort of mental health support.
Dr. Karen Barbie says more investment will help providers like her who are already in schools but can't keep up with the need.
I feel like we are absolutely drowning. For one school system alone, we have about 50 on a waiting list.
And in districts that need more support, the state launched NC PAL, a phone consultation and education program that gives schools rapid access to providers for guidance on how to handle students' behaviors. Dr. Gary Manslow says while these things are a step in the right direction, they're just a drop in the bucket of what is needed.
But there's a lot more that needs to be done, particularly to get it so that if you have a child who is identified as having a need in school, linking them to care at the school, in the medical system, in the mental health system, that should be really easy. And right now it's very complicated.
Pendergast is hoping leaders in schools continue to step up investments and resources so fewer families are left with the same hole in their hearts.
It was just heartbreaking.
And there is room for some hope. Last month, Governor Cooper announced a $1 billion plan to tackle mental health needs across the state. At least $200 million of those dollars specifically targeted mental health support within schools. For the I-Team, Samantha Coomer, ABC 11 Eyewitness News.